Hello everyone, I'm Dr. Naeja Bonnet. Welcome to my first class. Today's topic of fundamental nursing test taking strategies is one of the most important fundamental principles you should learn and grasp as soon as possible to avoid failing your nursing exams. When you fail an exam, you fall into one of these categories. Category number one, a content problem, means you didn't study as well or at all, and you didn't know the basics of a topic. For example, you don't know how the blood flows through the heart. Side note, please don't throw away all your mental notes on anatomy and physiology. You will need them. Second, you could be dealing with the application problem, meaning this is when you know the material, you know how the blood flows through the heart, but you can't quite understand mitral valve regurgitation. You can't put it all together. You really can't connect the dots to critically think. In the next 3 slides, I will go over 3 principles to always follow when answering questions. So this right here is one of my favorite sayings that I love to say to my student. And it is, you're the nurse taking care of this patient, and you can only do one thing to save their lives. What are you going to do? So in the next 3 slides, I believe they will help you be able to answer this question effectively and correctly. So we all heard of ABCs, right? Airway, breathing, and circulation. We all heard of that. But do you guys know that airway and breathing is not always going to be an answer choice? If it is an answer choice, you already know what to do. But I love this chart right here when it says priority one, meaning this is most important. Airway, breathing, cardiac or circulatory problems, right? And then you have your vital signs concerns, and then you have your lab values that are life-threatening, right? Those are things that are priority. Your second priority comes into as your what? Changes in mental status, untreated problems such as a diabetic who hasn't had their insulin, pain, urinary elimination problems, right? Side note, a patient not urinating, that is a serious matter. That is a priority. And I'm here to tell you, if airway, breathing, and circulation and all that stuff in priority number one is not an answer choice, I guarantee you, if that patient is not eliminating and voiding, and they're supposed to be voiding, that is a priority that you need to pay attention to. But anyway, back on topic. Priority 3 is like health problems that don't fit into the first 2 categories. So activity, rest, family coping mechanisms, and lack of knowledge, which are all important things, but guess what? It's not priority. So the nursing process, you will probably learn this in fundamentals, but I believe that the nursing process will forever go with you as a nurse. This is a concept that you really need to grab a tight grip on. So first of all, assessment. Assessment is what it is. It is assessing the patient, and it is a collection of subjective and objective data. So that's why you want to be listening to your patient when they're talking, because it may not be data that you can actually see, your objective things, but it may be the subjective things they say. Oh, I feel so fatigued. I haven't slept in nights. Oh, I just feel so weak. Things that you really can't see, but that is pertinent information that these patients give. Your nursing diagnosis. That is what is the problem, right? All right, our planning phase. We then begin to think of how to manage the problem. You come up with the plan. Our implementation phase, you put your plan into action. And your evaluation phase, well, did your intervention work? If it worked, good for you. But if it did not work, you need to start all back over. You need to start back over to see, hey, what did I miss? And why wasn't this intervention successful? One thing is important, always go back to evaluate if you just have implemented an intervention. So let's say a patient's blood pressure was 200 over 100. You gave some IV hydralazine. Hey, don't just go automatically and think that medication worked. No, you need to go back and evaluate, which would be reassessing that patient's blood pressure to see if it even worked, because sometimes it doesn't work. And then guess what? You go back to the planning stage, right? Okay. So Maslow's hierarchy of needs, this chart I fell in love with, because sometimes we get so grounded on our ABCs and the nursing process that we forget that we are supposed to be taking care of the patient holistically. That guess what? Their mind, their body, their soul, their spirit, all that matters to us. But like I said, the answer choices of airway breathing, hey, are not always going to be in answer options. So this is where, and you see in the dark red, where you're able to see that, guess what? There are other things that are just as important, such as food and in shelter and clothing, reproductive, and safety, all that stuff that matters to patients that definitely could be priority as well. So I've given you some resources to be able to answer nursing questions. So now let's talk about some tips to answering these questions. So especially with these long case studies. So first, you want to highlight the actual question. If you can highlight, if you still got paper and pen test, I think some computer systems let you highlight. But even if you have to highlight a mental highlight in your head, paraphrase it and make it understandable to you. Okay? Make it that you actually understand the question. Number 2, look for keywords that will guide you in your decision making. Need for understanding. First, priority, immediate, most concerned, indicates understanding. You want to eliminate distractors. Beware of negative terms such as never or none. And secondly, don't add to the question. Take the question as it is. And I said on here, don't add me to the question, meaning don't add you and your situation. Oh, well, they could. It didn't say that they were pregnant. They could be pregnant. The question did not say that. So don't add me. Don't add you to the question. Literally stick to whatever it is that it said. All right? Use the process of elimination and select the best choice. Again, beware of negative terms. So now let's talk about how to dissect these long case studies. So first, I say read the question first, then go back up to read the case study. Because when you read the question first, you kind of know what you're looking for. All right, note any pertinent information, such as age. Remember, as the patient ages, body systems tend to slow down. Objective and subjective data. Always listening to the client. Always looking at the client. Drowsiness. Patient reports fatigue. High heart rate. Pale skin. Lack of appetite. Does any specific disease process come to your mind as you start to see all this data? Guess what? The wheels in your head just begin to spin and say, oh, this could be this. This could be this. But let me keep on reading. Time frame. How long has this been happening? Or like in the case studies, they love to give you, hey, this happened at 1 o'clock. This happened at 2 o'clock. This happened at 3 o'clock. Pay attention what happens in these time frames. Also, lab tests and values. Understand how disease processes and medications affect certain lab values. And Also, know your medications. Then, answer the question. Focus on one answer choice at a time. I always say if you have to place your hand over the computer screen just to look at one answer choice at a time, hey, do what works best for you. But sometimes with these case studies, you get so overloaded because there's so many answer choices. But what you want to do is focus on one. Cover all the other ones up and look at it and take the question as a true or false statement. Is this true? Okay. If it's true statement, all right, I can choose that one. But if it's a false statement, hey, I'm not choosing that one. So that's the way to take all these select all that applies, these case study type questions. You want to take them as true and false statements.